Good morning, everyone. My name is Dr. Apoorva B. Kelagar, and I'll be presenting a paper on behalf of Dr. Vittal I. Nayak on a study to determine relationship between lid temperature, Schirmer's test, and T-BUT in normal and dry eye patients. We see that dry eye is a very common disease. It ranges from 5 to 50% worldwide, and the impact of dry eye disease per se is beyond vision. It mainly impacts the quality of life, which is quite comparable to the medical conditions like severe angina and also hospital-based hemodialysis. And physicians diagnose these diseases by various tests, signs and symptoms like T-BUT and Schirmer's test, and we use infrared thermography as a quick non-invasive test to screen for dry eye disease. This study has been supported by a study conducted by Arbu et al. On lid temperature and of ocular surface and periorbital regions of Sjogren's evaporative and aqueous deficient dry eyes relative to normal, noting the differences between Sjogren's, EDE, and ADDE. The aim of the study is to determine the upper lid temperature, Schirmer's test, T-BUT in normal and subjects and dry eye subjects, and analyze them and look for correlation. The study population was 100, out of which 50 patients were of dry eye and 50 were normal patients attending the OPD, and also the patients who were studying for long hours in library. It was done in Bangalore. The study duration was one and a half year, and the type of the study was prospective cross-section study. Ocular lid temperature was measured using F82 Beer's non-contact infrared thermometer by asking the patient to close the eyes, and the instrument was held perpendicular to the area of interest, about 1 to 1.5 inch away from the lid. The patients included were aged between 20 to 50 years, and patients having the symptoms and signs of dry eye and who had the exposure to VDT for more than 4 hours per day, continuous 4 hours per day. Exclusion criteria was obvious ocular inflammations like episcleritis, conjunctivitis, chronic usage of eyeliners, kajals, and usage of medications which cause dry eyes like pilocarpine, timolol, and steroids, and patients who were allergic to fluorescein. Statistical analysis was put forward in Microsoft Excel, and various tests were done using chi-square test, independent t-test, and correlation was done using Parsons correlation test. And in the results, frequency distribution in the study was about 48% were less than 25-year-olds, and more than 52 people were more than 25 years. And there was no statistical differences between the males and females. And Schirmer's, T-BUT were correlated to the existential studies. And lid temperature, average lid temperature amongst the normal and the dry eye, there was a difference noted of about 0.5 degrees C, and the results were analyzed, and the sensitivity and specificity for Schirmer's was about 90% and 83% respectively. And results, sensitivity and specificity for lid eye temperatures were amongst the normal and the dry eye were noted, and sensitivity was 72% and specificity was 78%, and having the positive predictive value of 76.5% and negative predictive value of 90.6%. An ROC curve was made for eyelid temperatures amongst normal and dry eye, and it was noted that the graph fell more on the sensitive side of the graph. In discussion, our results demonstrated the importance of Schirmer's 2 and T-BUT assessing the tear film stability in line with the studies and findings with the studies by Chaurasia et al. And additionally, eyelid temperature was significantly higher in dry eye patients, suggesting its role as a potential biomarker for tear film instability. Our findings corroborate with those of Lee et al., who reported increased eyelid temperatures following external heat application Furthermore, body temperature variations between dry and normal eyes were statistically significant, supporting the notion of local temperature fluctuations. On conclusion, our study established a strong inverse correlation between ocular lid temperature, tear film stability, reinforcing the diagnostic utility of thermography.
Thank you. Thank you very much. Thanks a lot.